Hello all, welcome back to the Biodocs channel. Today we'll be learning about the external genitalia or the vulva of female reproductive system. As you can see on your screen, what we are seeing is the pelvis of both the male as well as the female. When you look at the pelvis of both of the sexes, you can see that the one which is narrow, the one which has an angle less than 90 degree between the pubic bones, okay, is a male pelvis. And the pelvis which is very broad, where the pubic angle between the pubic bones is more than 90 degrees, is a female. Okay, this is going to initiate, or this is going to actually allow the childbirth. And the one that you're seeing here is going to be between these bones is pubic symphysis. Okay, so this is the major difference. And now what I'll do is I'll enter into the topic by sharing with you all the details of the external genitalia or the vulva of the female reproductive system. Okay, children. So we are speaking about the external genitalia, which we otherwise called as vulva. Okay, the parts that we can see are going to be clitoris. We can see labia minora. The next is going to be labia majora. Okay, and we can see the vertical depression where the vagina and the urethral opening are present, which is being called as vestibule. Okay, this is none other than the vertical depression. Vertical depression, where you can find where we can find the which parts, the vagina as well as urethral opening. Okay, that is called as vestibule. Next we'll learn about vagina here, which is enclosed in the vestibule. We will learn about the hymen, also an external genitalia. Okay, these are the major parts what we are going to learn today. Okay, these are the ones, and even we have some glands here on either sides of the vagina. Okay, that is, they are going to be the Bartholin glands, which are very similar to the Cowper's gland of male reproductive system. So we'll learn one by one the external genitalia of females. Now, this is going to be the clitoris, okay? And the skin folds that arises from here, this skin folds here arising from the lateral sides of your clitoris are going to be the labia minora. Let me label this for you. This is clitoris. Remember that clitoris is regarded as a homologous organ with the male penis. It is homologous with male penis because they have a same embryological origin. Okay? They have a same embryological origin. And the other important thing here is the way the penis is going to be engorged. Okay, the way your penis is going to be engorged with the blood. During what? During the sexual arousal. Sexual arousal. Same way your clitoris is also going to get engorged with the blood during the sexual arousal, due to which your clitoris is going to get erected. So that is our clitoris. Okay, so this one that you're seeing here is going to be the clitoris. The next one that I spoke was about the urethral opening. So the urethral opening is going to be this So this is going to be your urethral opening, urethral opening, which is being called as urethral orifice. Okay, urethral orifice. Urethral orifice is just for the passing of urine. So as in males, they had a urinogenital tract, a single opening, right? But for them, in the females, it's going to be completely different. Urine is passed out through the urethral orifice. And for the sexual, that is intercourse or the coitus, and for the childbirth, they have another opening which is being called as vagina. So if you look at the vagina, it's a muscular tube, okay? This is otherwise called as birth canal, birth canal. And the functions of the vagina are, one is, let me write functions here. They help in the sexual intercourse, which can be otherwise called as coitus. And secondly, this helps in the childbirth, due to which we call it as birth canal. Okay, and besides these, both of the, on either sides of here, vagina, we have a gland here. Okay, and these glands are being called as Bartholin's glands. Bartholin's glands. What these does is they are going to secrete the fluid. They are going to secrete the fluid in the vagina, which are going to lubricate the vaginal canal. They are going to lubricate the vaginal canal during the sexual arousal. Okay, children, and these are very similar to the Cowper's glands, as I told you. And so I can even write this as what? This is homologous to Cowper's glands, right? And next one that you can see is, so this is the vertical, let me take an imaginary vertical depression. So this is a vertical depression of the vulva, where you can find what? You can find the presence of this urethral orifice, and you can even see the presence of your vagina. So that is being called as vestibule. We are going to call that structure as vestibule. And look, children, these labia minora, they come and fuse at a particular point. This fusion is being called as forchet. We are going to call this as a forchet. So what is forchet? Is nothing but the area of fusion of the labia minora. Labia minora. Okay, I think the points are clear for you. So these are the urethral openings, and we are having on either side of the vagina the Bartholin's glands. The next thing that I would like to say is about the presence of the fleshy lips here, okay? The fleshy lips. And these fleshy lips here are being called as labia majora. They're being called as labia majora. The labia majora are they are the ones which are going to form the boundary of the vulva, right? They are the boundary of the vulva. They're completely homologous to the scrotal sacs of the males. They are homologous to the scrotum. Now, this is important. So we could see three homologous features: one with Clydorus with the penis, Bartholin's glands with the Cowper's, and labia majora having a homologosity with the scrotum of the males. Okay, they are being comprised of what here? They have a skin, they are having the fibrous tissue, they are having fibrous tissue, and they have a good amount of fat, the labia majora. Okay, children, they are present on either side of, because this is a vertical depression, right? This is a vertical depression. So they are present on either side of the vestibule here. You can see. So this is going to be the median line, the vestibule, and these are going to be the labia majora. These are the points. And nextly, what we can see is on the posterior side of here, vagina, we are going to have an opening, and this opening is none other than your anus, the opening of the rectum. Why am I speaking about this? Is there is a area, this particular area, okay, between the vagina and the anus, that is being called as what? It is being called as perineal area. Perineal area. Usually during the normal childbirths, what happens is if the child's head is struck in the vagina, not able to, the woman is not able to deliver the child and the head is being struck. So what usually they do is they have a what you call is they make a cut here from the vaginal area to that of in the perineal area, okay, such that it will be easy for the lady to deliver the child. Where that procedure will be called as episiotomy. Okay, we call this as episiotomy. Episiotomy is nothing but the cut made in the perineal area to enable the free childbirth. Okay, and another important thing here is, children, usually what happens is when we speak about the urinary tract infections, urinary tract infections are seen only in females but not in males. Why? Because females, usually what happens is when they are going to wipe, okay, when they are going to wipe this area, what happens is the materials from this portion are being traveled into this portion, right? Because we are wiping it off to clean it. So when they're going to wipe it off, what happens is the E. coli bacteria, which is usually known to cause the urinary tract infections from the anal area, is going to be moved towards the urethral orifice due to the wiping direction. And that is going to cause the urinary tract infections in the females mostly. Okay, so these are the points that you need to know. And then nextly what we are going to have is we are having a vascularized membrane here in the vagina. Okay, this membrane here, the vascularized membrane, is being called as hymen. Hymen. Usually hymen gets paired off during the intercourse, for the first intercourse, or sometimes in the athlete women's, because of the physical strain, also the hymen gets teared off, which is going to lead to bleeding. Okay, this is going to even lead to the bleeding also. And these are the main points of the female external genitalia. I hope you have understood. I have covered up all the points that you need for your examination. Okay, we have looked about all the hymen, the vestibule, the clitoris, mons pubis. Now I need to speak about the mons pubis. Now, what is mons pubis? As I told you that we have pubic symphysis, right? So near to the area of the pubic symphysis, just above the external here, this particular labia majora, we have a fleshy part. Okay, that fleshy part with the fat is being called as mons pubis. Mons pubis. It's very near to the pubic symphysis area. Okay, the fleshy part, the fatty area is being called as mons pubis. We are going to call. Remember, children, Bartholin's glands can otherwise be called as. We have another name. It is being called as Bartholin's glands. Yeah, they are being called as your bulbovestibular glands. Bulbovestibular glands. We can even call them as this. Okay, children. So these are the ones. Even we can consider not the external genitalia, but especially you can even see the mammary glands coming up. I'll make a special video to explain you regarding the mammary glands once we are done with the childbirth procedure. So these are the different parts of the external genitalia, okay, that you can see. Now what I'll do is I'll show you the slides of the female external genitalia. Then it will make sense for you all in understanding it good. Now, let me share this. Yeah, the first thing that I would like to show you is going to be this. So here you can see that this is going to be the pubic symphysis, from where you can actually see the production of that body of the clitoris, which is same as the glans penis, okay? And you can see the presence of the urethral orifice, the presence of the vagina, and you can see the presence of on either sides you can see the Bartholin's glands, which are being called as, here you can see the brown glands that you can see, okay, the brown glands, which are being called as greater vestibular glands, the bulbovestibular glands on either side of the vagina, or the bulbourethral glands, where you can sometimes see the formation of cyst also. Okay, small tumors are being formed due to the oversecretion of the porings of the Bartholin's glands. And here you can see that the labia minoras are going to fuse to form the fourth check. This is this. Okay, and next slide that I would like to show you is this one, where you can see the mons pubis, the fatty area that you can see around labia majora lips, nearby the pubic symphysis. Then next we are going to have the clitoris, the labia minora lips. These are the skin folds. Here will be the forecheck. This is the opening of the vagina. Okay. And inside we have the lining, which is going to be called as hymen. We are having the urethral orifice here, and these lips around it. These fleshy lips are going to be the labia majora. Okay. And next we'll see another slide where you can see the mons pubis. This whole fleshy fatty area is mons pubis. And you can see, as I told you, that clitoris is very much homologous to the penis, and they do even have the skin fold of prepuce. Okay, the skin fold is a prepuce. We can see the labia majora, and we can see the skin folds coming arising from here on the lateral sides of this, called as labia minora. Next, you can see the urethral orifice, from where we pass the urine, the vaginal orifice. We have the lateral sides, the Bartholin's glands. Next, the fusion is being called as forechet. Okay, children. Now, I hope the points are clear for you by watching up these slides here. Yeah, you can see the exact Bartholin's glands very nearby on either side of these particular, the vaginal opening. Okay, and the next one, the perineal area, I would like to show you. This will be the perineal area where the episiotomy is going to be carried out. So this part is going to be the mons pubis. These are the labia majoras, labia minora. Okay, coming on to another slide where I would like to show you the episiotomy. So if this is a vaginal canal, so this is a perineal area down where you have posteriorly the anal area of the opening of the rectum. So what they do is to enable the free childbirth, we are going to have a section of cut here being made to enable the childbirth. So this is a perineal area between the vagina and the anal area. Okay. So this is about the female external genitalia. I hope you all have understood. I hope even the slides made it better for you all to understand it far better. I hope you do well in your examinations after watching this video. It might have helped you. Please do comment in the comment section how you like this video, how it helped you, and try to please do share my channel. And if you like the video, please do hit the like button. Thank you all. Thank you.